Hello everyone, I hope you're doing well and everything is fine with you. Now in this video, what I'm going to basically do is discuss the rumors that are associated with the Australian Dental Council, all right? Because we get a lot of messages on WhatsApp, on the Academy's official Gmail address, regarding certain questions that keeps the candidate confused because internet is a corrupt place, and you get to hear from a lot of people who do post things regarding Australian Dental Council, which are not really true. All right. And most of these comments or posts come from those people who have not been through the Australian Dental Council examination pathway, or who are not dentists in Australia, or who have not cleared the ADC exam. So I wanted to make this video so that you have clarity on the Australian Dental Council and the rumors that circulate in regards to the ADC examination, the system, the pathway, the transparency that the ADC follows. All right. So this video will be discussing certain important questions, which actually ADC has also published on their official Australian Dental Council website as well. So I'll be picking up those points and discussing them so that you have clarity and you don't get confused by numerous posts and comments, advertisements on different social media platform, Facebook, Instagram, different websites, because majority of the information that you see on the internet regarding ADC, I would say almost 80 to 85% of the information is not really true. And like I said earlier, it is given by those people who have not gone through the Australian Dental Council pathway, who have not cleared the ADC examinations, who have nothing to do by practicing of dentistry in Australia or not working as a dentist in Australia. So getting guidance from someone who is not gone through the pathway is really that a candidate who's new to the ADC keeps them confused. So this video is going to discuss all those rumors, most of those rumors, I would say, because we have discussed a lot of things in our different other videos that we have on our YouTube channel. But certain points that I felt are required to be discussed, I have discussed them in this video. All right. So please make sure that you watch them, understand the system. If you have any further questions, you always have the Academy's detail to get in touch with us, contact us to clarify your details before stepping into the ADC journey. All right. Thank you. So we're going to discuss this. The first one that you have here is that the ADC doesn't provide feedback to candidates and would rather keep them in the system than allowing them to pass their exams. Now, this is completely untrue. The ADC examinations are designed to ensure candidates can demonstrate that they have the skills and knowledge of a recently graduated dental practitioner from an Australian program. The examinations are demanding, but so is the career as a dental practitioner. The ADC role is to uphold the safety of the Australian public and to ensure that dental practitioners can provide the high level of care expected by our communities. All right. Now, what ADC is trying to say here is that because ADC doesn't provide feedback to candidates, what it means is that they don't provide you in detail feedback in regards to the written as well as the practical exam. All right. You just get your score as a pass or a fail, right? They don't provide you with the feedback where you went wrong, what mistakes you made. But that doesn't mean that ADC does that purposely, all right, to keep you in the system and not allow you to pass the exam. That's not completely true. If you demonstrate certain level of competency that is expected of someone who has recently graduated a dental practitioner program or a degree in an Australian system, if you demonstrate a similar competency, there is no one holding you back from passing the ADC exam. All right. So don't have this thinking in your exam that the ADC purposely fails the candidate. I've been mentoring candidates for the last 10 years. When ADC fails a candidate, there is a reason why they have failed the candidate, whether it's maybe a minor error or a major error, depending upon whether you're sitting the written or the practical exam. So there is certain level of competency that you have not met, due to which you have failed the exam. All right. And of course, this video is not to discuss those mistakes. We have several other videos on our Facebook and YouTube where I have discussed those things. So please remember, when the ADC gives you a fail score or a pass score, that is solely determined on your performance on those two exams, the written and the practical. All right. They don't have any personal grudges with you. They don't care from where you belong, which country you're coming into and appearing for the exam. These things are irrelevant in the ADC system. As long as you're following what they're asking you for, as long as your performance is par, which means as long as your performance is according to what they expect for a dentist to as a practicing dentist, because ADC examinations are made for you to be able to practice as a dentist in Australia. So if you can't demonstrate the required knowledge, the required competency, and the required safety in order to practice your profession in Australia, ADC is not going to hesitate to mark you down. Now, please remember with the ADC, the examiners that you have, all of these examiners are clinicians, all right? They have been or they are currently practicing clinicians in different parts of Australia. So when an examiner assesses you, especially for the practical exam, the examiner, he or she sees whether this dentist, if we let them in Australia, will he or she be able to practice the profession in dentistry in a safe and in a manner consistent with what is expected of a recent graduate who completes a graduate program, a BDS degree in Australia. Are you competent enough to match that level? If yes, there is no one stopping you from passing the exam. If no, then of course they want you to take the exam again and again until you demonstrate that level of competency. All right. The second rumor that we have, the ADC won't allow older dentists to pass the exam. A candidate age is not considered when assessing candidate and is not shared with examiners. Also, aside from the candidate's ID, no personal details are made available to those assessing the task completed on the typhodonts in the simulation clinic. This does not allow examiner to know the names or personal details of the candidates they are marking. Now, please remember when you are doing the written exam or the practical exam, the examiners, the people who are assessing your tasks, they don't know about you. They don't know your name even. They don't know where you belong from, which part of the world you are sitting the exam if you're going for the written, because the practical is only held in Melbourne, or they don't know about your age. All they know about you is your candidate ID. This is what ADC does to make sure that there is complete transparency and the examiner have no idea. The only idea they have is your candidate ID plus what they have in front of them in regards to what you have done in the exam, whether it's the written or the practical. So age is not a criteria whether you are, let's say, in your 30s, your early late 20s, or early 40s. It doesn't make any difference to how or what level or how often you can pass the ADC exam. It has nothing to do a candidate who has, let's say, 40 plus and demonstrate the level of competency, passes both the written and the practical exam. There is nothing stopping you from doing that, right? We recently had a candidate who was 43 years of age and last month cleared the practical exam. She has moved to Australia. So like I said, it's age is not a factor as long as you're competent enough, demonstrating your required knowledge in the theoretical exam and then your required knowledge and practical skills in the practical exam. There is nothing stopping you. So age is not a barrier for the ADC exam. Now let's come to the visa pathway. Now, of course, ADC has nothing to do with your visa pathway for those candidates who are outside Australia, because once you clear the ADC, you will have to move to Australia. We have different videos on our YouTube channel in regards to that, the ADC pathway, what happens after ADC and all that. But to keep it short, once you are done with the ADC exam, depending upon which visa will be suitable for you, you can always migrate. There are different visas that you'll be looking for. Certain visas has age restriction, let's say less than 45 years. Certain visas does not have age restriction like a skilled employer visa 482, which is employer nominated visa. So you always have an option to move to Australia irrespective of what age bracket you belong to once you clear the ADC exams. Okay. During the practical examination, candidates' attempts are compared against each other to demonstrate pass fail. This is not true. Each attempt is marked individually and no comparison happens. The work that you do is what determines your mark, not the work of other candidates. What this basically means is, first of all, please remember what you do is what you get. So if your performance on the day of the exam is above the standards or according to the standards of their marking rubrics, you will pass the exam no matter what the other candidates are doing or it doesn't matter what you have done in the past performance. For example, you sat the practical exam for a couple of times, and let's say the third and the fourth time, let's say the fourth time, you were able to pass the exam. So ADC is not comparing your performance in the fourth attempt with the first three attempts that you did. They are totally separate, nothing to do with your performance. And the same goes for the written exam. If the candidate is not able to pass the written exam on the first attempt, in the second attempt, when you are being marked and scored, your performance in the first attempt has nothing to do with your performance in the second attempt. They are marked separately. All right. And you're not being compared according to the other candidates. Let's say you're in simulation clinic in the practical exam, you have 12 to 24 candidates in each session. So your performance is not being compared against them. Your performance is compared according to standards that the ADC has. If you cross those standards or if you meet that standards, that's what determines your pass and fail. Some examiners are trained to fail everyone they examine. This couldn't be further from the truth. All ADC examiners are required to assess each candidate fairly and using strict rubrics for each assessment task. This ensures that all examiners follow a standardized and reliable scoring process. Examiners' scores are also analyzed and checked to ensure that there are no errors. Contrary to what rumors you may have heard, the ADC also does not have any pass fail percentage quotas, and a candidate's pass fail result is only determined by their performance at a point in time, that is on the day of their examination session. Now this can't be more clear, and this is one of the most important thing that we see on the different social media platform, where the candidates get confused because of this is so much rubbish and nonsense information that you have, that some examiners are trained to fail everyone. That's not true. All examiners go through quality control courses, sessions, how they are going to mark the candidates. All right. And secondly, like I mentioned earlier, the examiners don't have your personal details. So they don't know who they are passing and who they are failing, because they just have your candidate ID. They don't have any information about who they are marking. So this is completely not true, and this is something that you should remember. And secondly, as they say that what the rumors suggest, ADC does not have any pass fail percentage or quotas. What this means is that for each examination session, what I've also read on different social media platform with these different mentors and tutors who don't have any experience with ADC in Australian industry, they keep telling candidates there is a quota system and this and that. There is no quota system, which means that there is no specific number of candidates that the ADC will pass for the written or the practical exam. It doesn't make any difference to ADC. If they want, they can pass 20% of the candidates. If they want, they can pass 40% of the candidates. It's all depends how good those candidates are in that session. So if there is a candidate, for example, in the written exam, because you have the written exam twice a year. So let's say in the March candidates, they were competent enough. So 35% of the candidates passed. In the September 2026, the candidates were not very competent. Only 15% of the candidates passed. So there is no fixed quota that the ADC is going to follow for the written and the practical exam. This is something that you should be very, very understanding about, because ADC does not have any quotas. As it says, the candidate's pass fail result is only determined by their performance at a point in time, which means your performance on the day of the exam. That is on the day of their examination session. All right. Candidates living in regional or remote areas of Australia are favored over those that live in the metropolitan areas. Our examiners don't have access to any candidates' demographic information. Like I said, ADC examiners don't know who they are marking, what their name is, how they look, which country they belong to. The ADC examiners don't have any idea about that. They do not know where candidates come from, where they studied, how long they have practiced for, and they do not know whether they live in rural, regional, or metropolitan Australian cities, or even overseas. All candidates are assessed solely on the basis of their performance on their examination session. Please remember again, the ADC does not really care where you belong from, what country you have graduated, where did you do your dentistry degree, whether you are in Australia, whether you are overseas. All these factors are irrelevant to the ADC examiners. Your performance is just being marked on what you have done, what you have demonstrated, whether it's the written or the practical exam. All right. Now, coming on to other major criteria, other major point that the ADC has pointed out, and actually they have pointed out this numerous times, the commercial preparation providers. The ADC is aware that there are commercial examination preparation providers that operate specifically with the sole purpose of assisting candidates to pass the ADC examinations. We are also aware that some of these providers make extravagant claims about the success rates of candidates attending their preparation courses, may mislead candidates about their own professional credentials, may attempt to solicit information from candidates about the ADC examination, at times providing incentive to candidates. The ADC strongly recommends that all candidates do their research and due diligence if choosing to sign up for a preparation course. These courses are often very expensive, and from the data we collect, they do not give candidates any additional advantage into passing the examination. Candidates should also be wary of any requests to share any examination content through private or public forums or platform hosted via preparation providers or other parties. Sharing examination content is strictly prohibited and constitute misconduct. Candidate found to be contributing may also be referred to a misconduct panel. Now, what does the ADC mean about the commercial preparation providers? Now, I have been mentoring candidates for the ADC written as the practical exam for the last 10 years. Over the span of time, what I have personally seen as well, that there are numerous academies, numerous mentors that have come up, which first don't have anything to do with ADC, or they don't have anything to do with the practice of dentistry in Australia. They don't even live in Australia. And majority of them who have attempted the ADC exam have not even cleared the ADC exam. So please make sure that when you're selecting a mentor for the ADC, whether you're selecting us, me, Dr. Raza Basbangash, or if you're selecting anyone else, make sure that you do your due diligence. Make sure that you do your research, because a lot of these mentors, some of them are even very famous, and you will see them all over social media, all over different advertisements. They have huge marketing companies advertising their courses. They have numerous fake IDs, fake profiles, anonymous profiles. They're commenting on different posts on Facebook, on Instagram, on YouTube, on Reddit. If you see these academies or these mentors, first of all, most of them are not even practicing dentistry in Australia. So just imagine you are attempting the ADC exam to become a dentist in Australia. How are you supposed to learn from someone who's not even practicing as a dentist in Australia? Secondly, some of these mentors are also who have attempted the ADC exam, failed it numerous and numerous times. So if someone who is not able to cross the boundary line themselves, how are they going to hold your hand and let or help you cross the boundary line? So please make sure that you do your due diligence. You are professional, you are a dentist. Although you're not dentist in Australia, but you're a dentist probably in some part of the world where you have done your dentistry degree. So you're not a child. So most of the candidates actually start acting quite childish and like a kid. You are going for an ADC examination, one of the most toughest examination of dentistry across the world. You have to make sure that when you're choosing the mentor, don't choose the mentor because you see more posts or more advertisements about them. And we live in the world of artificial intelligence. We live in the world of AI, where everything is so much fabricated. Nothing is true. Like I said, I personally have read so many comments, posts from anonymous IDs, from fake profiles, fake nicknames. These academies have, what they have done is they have hired marketing agencies where people constantly post and advertise so that that thing sits in your mind, and then you sign up for their courses. Please make sure that you do your own research. Go for a mentor. Whether you go with us, of course, we are qualified. We have been helping candidates for the last 10 years. Especially I, because I run the courses, the main courses for the written and the practical exam. I've been practicing in Australia, I've been practicing in Melbourne, I've been practicing in Perth. Right now, I practice in 3 different clinics. So when you choose a mentor, do your due diligence, do your own research work. You should always go for a mentor who has cleared the ADC written and the practical exam. You should go with a mentor who is practicing as an Australian dentist so that they can help you, because most of the things in the written and the practical exam are related to the clinical side of dentistry. That's why the written exam is also called as clinical knowledge based examination, because they don't want you to focus on the basic theoretical things. They want to see how you convert that theoretical knowledge into a clinical outcome. That's what the examination is about. That's why the examination is a scenario based question exam, the written exam, where you deal with questions that replicates or simulates a clinical environmental. So if you are learning from someone who has not even practiced in Australia, who's not practicing as a dentist in Australia, how are they going to help you with infection control, oral health promotion strategies, the rules, the AHPRA, the ADA, the complaint policy, the professionalism, the ethics? This is no one can teach you this being overseas or not even passing the ADS exam or not practicing as a dentist in Australia. And to tell you very frankly, the easiest way for you to do is just go to the AHPRA website, all right, and just type in the register of practitioners your mentor name. Here I've just shown you a sample. If you type my name, Dr. 𝗬𝗲𝗏𝗏𝗀, you will see that they will show you the details that this a person is registered with the Australian Health Practitioner Regulation Agency as a dental practitioner, and then you have a registration number as well. So, any mentor, if you choose us, of course, you can always check, cross check this information. But if you choose any other mentor, make sure that you're checking this information because this is very valuable. Always learn from someone who has crossed the pathway, who is in a position where you would like to be in a few years' time. All right. So, yeah, I hope this video gives you an insight about the rumors that circulate on different social media platform and help you get an answer to those rumors and gives you a factual information. And please make sure always watch the other videos. We occasionally post different kinds of videos on our YouTube channel, on our Facebook in regards to the ADC, the system, and we already have a lot of videos. So make sure that you watch them, learn from them, understand them, have patience with your ADC journey. Don't just want everything to be wrapped up very quickly. Understand the system, understand what the examination is expecting, and things will slowly and slowly gain clarity as you get into the system and get more familiar with it. All right. Thank you so much.